Is passing laws enough? Well, this slide is a slide of a study done by the Insurance Institute for Highway Safety, where they gave 2 people under 21 some money and said, see if you can buy alcohol in the nation's capital. So in Washington, D.C., they went to 100 liquor outlets. 98 of them sold alcohol to these kids illegally. So it's not just enough to pass a law. There's a whole process of police and court enforcement and public education about why we need the law and how it's going to be enforced. It's needed to create deterrence, to change public perceptions about alcohol, and in turn reduce drinking and driving and fatal traffic crashes. And this is best done at the community level. Now, if you wanted to further reduce alcohol-related traffic deaths in your community, how would you do it?
Decrease outlet density.
That's one thing you could do. Another one is you could expand screening and brief intervention. Larry Gentilillo worked at the Harborview Trauma Center in Seattle, Washington. A trauma surgeon. But he wanted to know why people end up in trauma centers. Well, he monitored it for a year. Half of the people who ended up on life support were there because they'd been injured under the influence of alcohol. Erwin Hirsch was the director at Boston Medical Center, of our trauma center. He saw that study, he said, let's find out what it is in Boston. 43%. And so it goes. The 2.25 million trauma center visits in the United States, half of them are the result of injuries under the influence of alcohol. But Larry took it a step further. He then did a randomized trial where he randomly allocated half of those patients to receive 30 minutes of counseling. Here's how your drinking compares to people, same age and gender. Here's what your likelihood of injury or illness is if you continue to drink that way, and here's where you can get help. Pretty simple formula. He followed them up a year later, and they were averaging 3 drinks less per week, 47% reduction in new injuries requiring emergency department help, 48% reduction in hospital admissions, and 23% fewer drinking and driving arrests in the group offered. He caught them, he believes, at a teachable moment, where they'd just been so seriously injured because of their drinking that they ended up in a hospital. So that's one thing. But unfortunately, most young people aren't being screened. We did a national survey, and we found that 2/3 of 18 to 39-year-olds had seen a doctor in the past year, but only 14% were given any kind of advice about what level of drinking posed risk for their health. And the people who were least likely to be asked were the 18 to 25-year-olds, who were the ones who were most likely to exceed the low-risk guidelines and meet alcohol dependence criteria. So precisely the people who should be asked are the ones that have been left off the radar screen. I dedicated this article to Helen Marie Whitty. I spoke at the 30th anniversary of Mothers Against Drunk Driving, and a woman came up to thank me for what I do. And she burst into tears before she could start to talk, because 10 years earlier she'd lost her daughter to a teenage drinking driver who rode up onto a sidewalk where she was rollerblading and struck her and killed her. And there are barriers to screening. It takes time to ask questions, time to respond. There's lack of training, so we've developed guides for clinicians about how to do screening and brief intervention. There's lack of treatments, centers for referral, and reimbursement issues. This next slide is a map of the United States. The states in blue have laws that allow insurance companies to withhold reimbursement for treating people who've been injured under the influence of alcohol. Now, if you think about it, that's a terrible disincentive for physicians to find out why are these people washing up on our shore to begin with. Fortunately, the states in pink have in the last 4 or 5 years repealed those laws. So I think a very important research question is, in those states, are more people now being screened, and will there be population level reductions in alcohol-related injuries? How can you further reduce alcohol-related traffic deaths in your community? Well, I think the most effective approach is what are called multi-component community interventions, or comprehensive community interventions, that involve multiple departments of city government, the health department, police department, school department, alcohol beverage control, and have multiple program strategies: education, media advocacy, community organizing, environmental policy change, heightened enforcement, and expansion of treatment facilities. And there have been a number of programs. We had one here in Massachusetts called the Saving Lives Program. There have been a whole host of these programs that have been shown to be effective. I don't have time to go through a lot of them. I'll give you just a couple of examples. This community trials. They did compliance checks to reduce sales to minors. They did sobriety checkpoints, alcohol outlet density reduction, community mobilization, media advocacy, responsible alcohol service. The result, we got to cut self-reported drinking and driving in half, 10%, 11% increase in the type of crashes most likely to involve alcohol, and a 40-30% reduction in emergency department visits. We looked at the program called the Fighting Back program. It was the first one to try to use policy to reduce availability of alcohol, but at the same time dramatically expand screening and brief intervention. And what we found was over 10 years in the 5 communities, compared to 5 comparison communities, each drawn from the same state as the intervention community, over a 20% reduction in alcohol-related traffic deaths, and particularly in the 16 to 20-year-old age group. We're now finding that these types of programs are even effective with the hard-to-reach college students. Bob Saltz did a superb randomized trial with the public university system out in California, where he randomized against 7 schools and compared them to 7 other schools. The schools that received the intervention, they targeted times and places where drinking to intoxication was common. It was generally off-campus parties. They had a social host party campaign, compliance check surveys to reduce alcohol sales to minor, sobriety checkpoints, police patrols, targeting the college student parties, and social host ordinances that would penalize community or the people who hosted parties that resulted in police being called to the scene. They found that during the first year that that program was in place, at the average campus there were 10,000 fewer incidents of drinking to intoxication. That's a lot of mayhem that they were able to prevent with that intervention program. Similar one has been done in North Carolina. Ann McCart did an excellent program where she went to Marshall University in Huntington, West Virginia. They increased DWI law enforcement, zero tolerance law enforcement, and through sobriety checkpoint saturation patrols, and a multimedia campaign that the colleges worked together with the city on. And what they found was that they did roadside surveys where they actually stopped drivers and tested their blood alcohol levels, and they found reductions in elevated blood alcohol levels in the intervention community, but not in the comparison community. So let me conclude by saying, look, we know that state-level legislation, such as illegal drinking age, zero tolerance laws, administrative license revocation, lowering legal blood alcohol limits, all of those things can make a difference. We also know that community-level interventions, that's where the rubber meets the road, and where we really have to coordinate multiple city departments, have clear measurable objectives, combine education and enforcement, treatment programs, use data to plan and evaluate, and involve private citizens and be inclusive. And I think this is really the most important thing. Involve young people as part of the solution. You know, the majority of young people don't binge drink. Majority of young people don't drive after drinking. There's a group out there that can be tapped into. The best example I ever saw of that was Mothers Against Drunk Driving held a national youth summit where they had one young person from each congressional district come to Washington for a 3-day briefing. It wasn't like the health education I got back at high school, where, you know, if you do this, you're bad, and it's bad, then will happen to you. Here they tried to appeal to their leadership. They said, look, you guys are going to be running the show soon. Come up with a solution. We're going to give you the best facts and figures we can. Devise a plan. Well, it turns out that on the day they were holding a press conference on the west steps of the Capitol, that's the mall and the Lincoln, Washington Monument and so on the day that they were holding a press conference, releasing their strategy to the press, that was the day that, by happenstance, Congress decided to vote on whether or not to lower the limit down to .08. So we took the delegates from the states of the committee members that were going to take the vote, and we took them up, and the police monitor figured out right away. She put them in front of the doorway so that the legislators from their states couldn't get in there until they talked to a young delegate from their state. Well, there wasn't enough room for all of us to go in and see the vote. But and it had been defeated a couple of years earlier, so we didn't know what really to expect. So we were out there waiting in the hall, and suddenly the doors flung wide open, and the bill had passed. These are the people I was with. This was Millie Webb. I told you the story about her family. Wendy Hamilton, her sister was an emergency room nurse who was declared dead after being struck by a drunk driver in the emergency room where she worked. Brenda Frazier, her daughter Ashley, was waiting for a school bus at 8:30 in the morning when a young woman who had been out partying the night before, her blood alcohol level had come down to .08, drove up onto the front yard and struck Ashley and killed her. And Janie Fair lost her daughter in the Kentucky school bus crash. Well, that day, they all had smiles on their face because they knew that this life-saving legislation had been passed, and they knew, better yet, that these young people were part of it, that they helped to make it pass. In fact, they were so important that when President Clinton signed the bill in the Rose Garden, he invited the Maryland youth delegation to be there with some of the victims because he knew that they had been an important part of the process. Well, after that federal law passed, Massachusetts had not yet adopted .08, and I wanted to know, well, what's going to happen here in Massachusetts? So I went to the State House and I saw the debate in the House, and all the green lights went on, so it passed unanimously there. And then I went to the Senate, and there was one senator who kept introducing, let's send this to Ways and Means, or let's do this to the delay or that to delay. And they kept voting him down, voting him down. And finally they took a roll call vote. Yes, 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 yes. And it got to him. Mr. President, I want my vote counted. Reluctantly, yes. So finally it passed unanimously in the Senate here in Massachusetts. And I went down to the chamber to thank the senators who'd been working on the bill, and a young woman came up to me and said, Dr. Hingson, do you remember me? I remember her very well. She was one of Stephen Ross's classmates. She was one of the people who held that candlelight vigil. And she had invited me to speak at the last assembly of Stephen's class before they graduated. And so I did. And I said, you know, you people probably don't have no idea, but there are now 28 states that have passed the Stephen Ross law. Now 50, but at that time it was 28. And you got it started here in Massachusetts. It was your class that did that. So then they had an open mic, you know, where people could come up and talk about Stephen. And it seemed like forever until finally one young student came up and said, hi, I'm Kevin, I'm the class dork. You all know me. I know you all know me because you've all picked on me. I just want you to know there was one person in this class who never picked on me. And that was Stephen. So I said, Gabrielle, what are you doing here? She said that she had been so moved when the Stephen Ross bill passed that she decided to go into public service. So she went to Boston College in political science and then Suffolk Law School. And I said, but Gabrielle, what are you doing here in the Senate chamber? It turns out that she was working 10 years later on a bill that we tried to get passed when Stephen died. She had that day worked on the unifying legislation. What was she doing there? She was the chief aide to the chairman of the Massachusetts Senate Criminal Justice Committee. Well, I learned a lesson that day, and that is that if we involve young people, again, remember, most of them don't drink, don't binge drink, and most of them don't drive after drinking. If we involve young people in trying to address alcohol misuse, which is, after all, the leading contributor to injury, which are the leading cause of death among young people, if we can involve young people, we'll be more effective in reducing the leading contributor to the leading cause of death of young people in the United States. So thank you very much for your time.